conference of the Joint Control Mechanism of the State Council, President Xi Jinping emphasizes to have continued close collaboration with WHO and the relevant countries affected by the epidemic, and jointly maintain and defend global security. Premier Li Keqiang points out that our coordination and cooperation with relevant countries affected by epidemic are important, and we should guard against the importation of the epidemic. So we have with us today DG Cui Aiming from the Department of Consular Affairs of Ministry of Foreign Affairs, DG Lin Wei from General Administration of Custom, DG Liu Haitao from National Immigration Administration, DG Zhu Tao from Civil Aviation Administration of China. They will take questions related with relevant fields. We have also with us Dr. Xu Jianfang from the General Administration of Sport to give us health knowledge tips. Let me first give you the update of the epidemic. Yesterday, China's mainland reported for new increased confirmed cases 573, fatal cases 35, including 34 in Hubei and 1 in Henan. For newly increased suspected cases 132. For newly increased cured and discharged cases 2,623, close contacts removed from medical observation 8,620, and the severe cases dropped by 299 by the end of yesterday. According to the reports from the provinces and the Xinjiang Production and Construction Corp, there are now 35,329 confirmed cases, including 7,365 severe cases. In total, there are 41625 cured and discharged cases, 2870 fatal cases, 79824 confirmed cases, and 851 suspected cases. In total, close contacts traced 660716, and close contacts still under medical observation 51856. For Hubei, the newly increased confirmed cases 570, including 565 in Wuhan. For cured and discharged cases 2,292, including 1,675 in Wuhan. Fatal cases 34, including 26 in Wuhan. Now there are confirmed cases 32,959, including 27,700 in Wuhan, including 7,107 severe cases, including 6,393 in Wuhan. In total, the number of cured and discharged cases 31187, including 19227 in Wuhan. Fatal cases 2,761, including 2,195 in Wuhan. Confirmed cases in total 66,907, including 49,122 in Wuhan. For newly increased suspected cases 64, including 50 in Wuhan. Now there are suspected cases 646, including 393 in Wuhan. In total, we have received 144 cases confirmed and reported in Hong Kong, Macau, and Taiwan, including 95 from Hong Kong SAR, 10 from Macau SAR, and 39 from the Taiwan region. Excluding Hubei, the newly increased cases throughout China, 3. So for 3 days in consecutive terms, we have maintained the single-digit number for the increased cases, and the severe cases dropped by 36. Over the past week, Wuhan, Hubei, and the nationwide cure rate for confirmed cases are constantly on the rise. nationally, 52.1% of the cases are cured and discharged from hospitals. This indicates that we are now enjoying a sound momentum for epidemic control, and the pressure on treatment is being eased. For the next step, we are going to resume the normal operation and guard against the risk of case importation. And we will continue to focus on Wuhan and emphasize the principle of differentiated and well-targeted measures. Now, the Q&A. Please focus on today's theme and put forward your questions. As usual, please first identify yourself. Now the floor is open. The first question on the right, on the front row, the first reporter. Thank you. From China Media Group, CCTV. At the moment, many Chinese nationals are now stranding in other countries because of previous travel or business. So will China send a chartered flight to take them back? And what are the measures to protect their health? Thank you. DG Cui, please. At the moment, the epidemic spreads in some countries in the world. For countries like ROK, Japan, Italy, and Iran, with a fairly large number of confirmed cases, there are many Chinese students and nationals. The Chinese government is highly concerned about their health, and we urge the countries related to take good care of Chinese nationals. In particular, we wish to help them to overcome the health concerns. The Ministry of Foreign Affairs, in particular our foreign embassies and consulars, are following very closely the Chinese nationals' health, and we have conducted active measures. At the moment, for countries severely affected by the epidemic, they have not cut shut the public transportation. So for Chinese nationals stranded there, they can take transit flights and come back to China. For Chinese nationals who wish to stay put, and I hope they can cooperate with the local governments and strengthen their health protection. In case of emergency, they can seek help from the local governments and get in touch with the Chinese embassies and consulars in that particular country or locality. If the epidemic continues to spread and the Chinese nationals' health are threatened, we will take necessary measures to bring the Chinese nationals back. For people who traveled from these epidemically affected countries and localities, they need to abide by the local requirements for epidemic control. Let's continue on the left, on the first row, and the second reporter, please. Thank you. From China Daily. The overseas increased cases have exceeded that of in China, so there is a bigger pressure in terms of case importation. So what are the measures adopted by the General Administration of Customs to protect the health of the travelers? DG Lin, please. Thank you. Good afternoon. For COVID-19, since the outbreak, GAC has worked under the overall guidance of the Central Committee of CPC and the Chinese government. We have implemented the relevant laws and regulations, such as the customs law and the WHO international health regulation. We have adopted both domestic and international measures to prevent the potential spread of the epidemic.
We have adopted the following measures. First, follow closely the epidemic unfolding, make analysis and judgment. We've been following closely the unfolding home and abroad and collected information from various channels. Because of the different stages and unfolding of the epidemic, we've organized a multi-sectoral and multidisciplinary analysis of the risks. Based on the conclusion of the risk rating, we've adopted targeted measures at various ports of entry to ensure scientific prevention and control and precision in policy implementation. Second, we've initiated health reporting and declaration system across the board. For all those going through points of entry, we'll have to file this declaration, and based on the health declaration record, we conduct screening. And we ask questions as to whether you have been to an epidemic hit area or country. Have you been exposed to contacts? To facilitate the health declaration, we have translated the declaration card into 10+ languages. We've also developed an app for the online registration. Even before passengers arrive at the point of entry and exit, they can fill in the information online so that it is real time. Third, we have a rigorous quarantine at the points of entry and exit. 3 checks, 3 screenings, and 1 transfer were adopted. 100% of the check have been carried out over the health declaration, 100% of the temperature monitoring, and rigorous random checks of the medical checks for those who have shown symptoms or onsets, and those who come from seriously hit epidemic areas, or those who have been exposed to confirmed or suspected cases. We have a rigorous epidemiological, medical, and laboratory screening and tests. And 1 transfer means those who have been confirmed or of suspected cases based on the previous steps will be transferred, quarantined, and put on medical observation following rigorous protocols and standards. With that, we ensured early detection, reporting, quarantine, isolation, and treatment. Meanwhile, because of the outbreak of other infectious diseases in other countries like the Laksanu fever and the Ebola, we have a rigorous check at the point of entry to prevent against importation of other infectious diseases. Fourth, we have been emphasizing the importance of the joint prevention and control mechanism and the joint leadership of this task force. Customs administration has been collaborating with other departments. Prevention and control protocols made by National Health Commission has been guiding us to update our port of entry and exit control. We set up sharing platforms for information and collect more data and facts. We've also been following the technical guidance at the port of entry and exit and properly deal with different groups at different risks, so that such mechanism is multi-layered and looking at different fronts. Thank you. Next question, please. Journalist from the second row on the left side. Thank you. With Xinhua News Agency, we all know that there are more and more pronounced outbreaks in neighboring countries. The prevention against importation risk has been mounting. I'd like to ask the National Immigration Administration, as we are ramping up the checks at the ports of entry, what are the collaborative measures adopted with the General Administration of Customs? I'd like to ask DG Liu Haitao from NIA to take the question. Thank you for the question. Since the outbreak of the epidemic, to effectively prevent the importation or exportation of the epidemic, National Immigration Administration has announced some restriction measures and advices. We advise Chinese residents to cancel or postpone outbound travel plans. Many Chinese have responded actively to the alert from National Immigration Administration and have cancelled their outbound travel plans. Many passengers, even upon arriving at the port of exit, has cancelled their plan on the point of the port of exit. And our Chinese people have made a great contribution to the prevention against the epidemic exportation and the protection of the international health security. I'd like to, on behalf of the National Immigration Administration, thank the Chinese for their support and coordination. As we see there is a mounting risk of importation, National Immigration Administration has prioritized the prevention against importation risks. We have the entire procedure planned to prevent against the risk of importation. Prior to the arrival of international flights, we have conducted big data-based analysis. For those who are traveling from the epidemic hit regions and countries, we have a pre-analysis. The pre-analysis results will be provided to the General Administration of Customs and will then be fed to quarantine and inspection departments so as to ensure timely check on the potential or suspected travelers. After the international flight has arrived at the airport, the border or frontier inspection agencies will check the situation of those who have had history of residence or history of exposure in the heavily hit areas, and this information will be reported to the Inspection and Quarantine Department of the Customs. Besides, National Immigration Administration has also timely reported the relevant information to the government and local jurisdiction and relevant departments where these travelers are flying to, and we've supported the local jurisdiction with information support. Down the road, we will be engaged in further international collaboration in bilateral or multilateral fashions. We will collaborate with the authorities of the countries where there is a serious epidemic. Information communication will be stepped up. The experiences and practices of border and port inspection will be shared for a joint prevention against importation risks, and thus preventing against the transmission through the ports of entry and exits. Thank you. Next question, please. A journalist from the right side.
Thank you. From the new media, CCTV News, netizens are very concerned about the importation of the epidemic, and how about the coordination and collaboration among the countries in the world, and what are the Chinese specific measures? DG Cui, please. Well, for the COVID-19 epidemic, it is a common challenge faced by the whole humanity, and it needs the joint coordination and collaboration by the international community. Since the outbreak, the Chinese government has adopted very stringent and comprehensive as well as thorough control measures. China has contributed to the prevention of the spread and has sought window opportunity for the whole world. Previously, some countries have adopted various restrictions concerning the Chinese nationals' entry into their countries. Most of them adopt such measures to protect the local and the international travelers' health and the regional and international health security. The measures are professional and science-based and also appropriate. We understand such measures. However, there's a couple of countries who have had overreactions. They have adopted unnecessary restrictions, and we have lodged representations with them. At the moment, the international travel between China and other countries are in general smooth and do not have many obstacles. However, the epidemic is changing, and we will follow very closely the epidemic situation in the relevant countries. We stand ready to join hands with the relevant countries and jointly strengthen the control measures at the entry of and the exit of the points, the ports, and jointly safeguard the health of people. Thank you. Let's continue. On the left, on the second row, the reporter in white. Good afternoon. From China Gateway Times. At the moment, quite many domestic airlines have resumed their international flights. However, now the epidemic is spreading in some countries. So how to ensure the safety of the international flights? And also there are Chinese nationals who are stranded in some other countries. So what are the measures the Chinese government has adopted to ensure their safe return to their motherland? DG Zhu Tao, please. Thank you for your question. CAAC has adopted a series of measures to prevent the potential spread of epidemic. For example, we have strengthened the ventilation and disinfection in the airports and on the flights. Also, for frontline staff, their health is protected by strengthened measures. And also, we have worked out health guidelines offering guidances to their protection. Also, CAAC has worked out phased and differentiated control measures in the light of the local conditions and the features of the flights. So we have adopted a differentiated approach to offer precise and well-targeted measures. Also, we stand ready to share with the international community our experience in dealing with the epidemic. the relevant technical guidelines have been offered to the relevant counterparts in ROK, Japan, and etc. We are also discussing with the relevant countries to come up with a harmonized technical guideline to prevent the potential spread of the epidemic. Furthermore, CAAC has strengthened its collaboration with the international community. For instance, we have worked with the World Aviation Organization to work out relevant measures. We are also working closely with our domestic sister agencies like Ministry of Foreign Affairs. For Chinese nationals stranded in other countries, we have worked out the regular plan to bring them back and also to transport the epidemic control supplies. We will continue to maintain close collaboration with the Chinese embassies and the consulates to bring the Chinese nationals back. Thank you. Let's continue. On the right, on the third row, the lady reporter. Thank you. I'm from Economic Herald. We noticed that some countries have adopted entry restrictions on Chinese nationals. Then, as the epidemic is spreading internationally, will China adopt such entry restrictions? DG Cui, please. Actually, I touched upon this issue when I answered the previous question. Because of epidemic containment, indeed, previously, there are some countries who have adopted entry restrictions on Chinese nationals, but most of the measures are justified and appropriate. For some overreactions, we've already lodged representation. Naturally, we will follow closely the international epidemic situation and strengthen the relevant coordination with the relevant countries. And of course, we will consider to reduce some unnecessary cross-border travels. We wish to work together with our international counterparts and ensure the sound traveling of such international personnel movement to minimize the negative impact of the epidemic. Okay, let's continue. The gentleman on the third row. From People's Daily, we noticed that DG of WHO declared that the global risk of epidemic should be raised to very high. So for GAC, for the GAC, how are you going to respond to such a new change? Thank you, Mr. DG Lin Wei from GAC. Thank you for your question. With this sudden outbreak, GAC has adopted effective control measures. At the moment, both domestically and internationally, the epidemic control is at a crucial stage. GAC will earnestly continue our efforts to implement the containment measures and consolidate the results that we have already achieved at home. Internationally, WHO has already raised the risk of COVID-19 from high to very high. This is indeed a challenging situation now, and together with the sister agencies, GAC has continued the earnest implementation of the containment measures.
We have prioritized the prevention against the importation, in particular those made through the port of entry. Within our capabilities, we have tried all the means. We have been following closely the unfolding of the epidemic in overseas countries, made analysis, came to conclusions, and made adjustments to the focuses of our frontier checks. We will continue to rigorously check the health declaration cards and maximize its role in the precise identification of the high-risk travelers. We will continue to step up the temperature monitoring. Now we have 2 layers of the temperature monitoring to effectively identify the high-risk groups. We'll continue to enhance our checks on the transportation vehicles coming from the epidemic hit countries so as to ensure early identification and early control of the imported risks. The disinfection of the inbound transportation vehicles have also been strengthened. We'll further enhance collaboration with the agencies and institutions and the Joint Prevention and Control Task Force. Just as our colleagues from the National Immigration Administration and Ministry of Foreign Affairs have mentioned, our joint collaboration worked towards the same direction of prevention against the importation. Thank you. Next question, please. Thank you. From CNS, some say there are foreign nationals with their visas almost at the expiry date, but they cannot leave China. So are there any specific measures targeting at a situation as such? I'd like to ask DG Liu Haitao to take the question. NIA has already considered the same issue. We've also adopted some facilitation measures with flexibility. Those foreign nationals who see their visa almost expire, they can have their stay period extended by 2 months automatically. Within those 2 months, they don't have to go through procedures for extension, and they can still stay in China legitimately or have the exit legitimately. Because of the special tasks undertaken for prevention and control for those foreign nationals engaged in medical prevention control, medical drug development, and research exchanges, the local immigration administrations and public security agencies will provide emergency services for those foreign nationals who come to China to be engaged in prevention control and other important business, commerce, and research projects. We have also been promoting the urgency services provided to such foreign nationals. They can apply for visa upon arrival at China. Besides, we are still at a crucial stage of prevention and control, and to minimize the people movement and public gatherings so as to reduce the risk of cross-infection and crowd-infection. National Immigration Administration has promoted the e-governance services online. The foreign nationals in China, just like all the Chinese nationals, can enjoy online application and delivery of the visas and other favorable policies, the timely checks of the visa processing stage. Thank you. Next question, please. Journalist from the fourth row on the left side, please. Thank you. From China's Aviation newspaper, recently we've seen the ballooning of the outbreak in Japan and ROK. I'd like to ask about the status of the international flights to and from Japan and ROK. Thank you. DG Zhu Tao will take the question. CAAC has been following closely the changes of the international flights between countries with the ballooning outbreak and our country, for example, Japan and ROK. The ballooning of the outbreak has stunted the relevant international flights with the cancellation of some international flights this week. Those between China and ROK have been reduced to 320, and the next week will be further reduced to 276. And in Japan this week, over 300, and next week it will be reduced to 260 plus. You can check online for specific information. Thank you. Next question, please. Journalist from the fourth row on the right side, please. Thank you. From 健康报 JKB. We found the rapid spread of the epidemic in overseas countries. Countries have adopted their measures as well. So what is our overall consideration for checking the inbound travelers to China? I'd like to ask DG Cui Min to take the question. In light of the current situation, based on local prevention control needs, for travelers from epidemic hit regions and countries, inspection, quarantine, and preventative measures have been adopted on the inbound travelers, such as temperature monitoring, home stay observation, and mass observation. These measures are in compliance with China's laws and regulations. They are also in compliance with the needs for the prevention against the spread of the disease home and abroad. So such measures are beneficial for domestic and international efforts in the prevention against the further spread of the epidemic. Local Chinese governments will also dynamically adjust the measures adopted on inbound travelers. For foreign nationals and domestic nationals, we have the same standards. We are impartial in adopting these measures. Besides, we will consider fully the reasonable care and concern of the inbound travelers. We respect their religions and the folk cultures and habits. After they come to China, the communities they reside in will also provide foreign nationals with needed support so as to provide daily necessities and deal with their actual concerns. The measures adopted by China have effectively curbed the spreading of the disease and stopped the transmission of human to human passing on of the virus, and our efforts have won high acclaim from the WHO. Currently, our prevention and control is at a crucial stage. It is our sincere hope that the countries hit heavily by the epidemic, if their foreign nationals are coming to China, they can understand and support our measures in prevention and control, so as to do a good job in the curbing of the spreading of the transmission and safeguard everyone's health. Thank you. Next question, please. Journalist from the right side.
主持人。
Thank you. From CNR. Recently, many Chinese trains, regular trains, have resumed operation. How to ensure the efficiency and the sound operation of such trains? Thank you for your question, DG Lin, to answer your question. Just as you have said, to support the growth of the China-EU regular trains, the GAC worked out 10 measures. These measures include allowance for the businesses to clear the customs at locations they choose, to facilitate the multimode transportation of the China-Europe regular trains, and to facilitate and support the mail trains and the transportation trains, and also to set up bonded areas for the regular trains to encourage the growth of the regular trains and the sound operation. These measures will greatly boost the convenience of the regular trains and have more transportation capacity and facilitate the interconnectedness. We know that safety is the prerequisite for growth. At the moment, the epidemic control is the guarantee for the sound and timely operation of the regular trains. Therefore, the GAC has adopted specific measures to facilitate the operation of the regular trains between China and Europe. There have been specific guidance offered, and also we emphasize the health protection for the staff working on the regular trains. Also, there have been emergency response plans developed, as well as disinfection measures implemented to guard against the potential spread of the epidemic through the regular trains. So with the above-mentioned measures, we try to ensure the orderly operation of the regular trains between China and Europe. Last two questions. On the left, on the fifth row, the third reporter there. Thank you. With Beijing news, recently there have been a lot of media coverage concerning the expensive airfare from ROK to China. So what's your comment on that? DG Liu Haitao, please. Thank you for your question. Indeed, it's a hot topic recently. The National Immigration Administration is following closely the traveling between China and ROK. We've made some analysis. As you may know, on February the 23rd, the Korean government declared to have the highest level of response regarding the COVID-19. From February the 23rd till now, according to the information we have collected, the number of Koreans coming to China on average daily is 1,300 person times. In terms of the flight occupancy, we can see that some of the airlines have reduced their flights between China and ROK. This has led to the short supply of the airfares. But in terms of travelers from ROK to China, we can see some slight increase, but not a major increase. we are following very closely the movement of personnel. In terms of the personnel traveled from ROK to China, we can see that most of the passengers are Chinese nationals. And they represent 70% of the travelers from ROK to China. For the slight increase of travelers, the majority of them are also Chinese nationals. Up to now, we haven't found many Koreans flowing into China. Thank you. Last question, please. On the right, on the fifth row, the journalist in blue. Thank you. From Shenzhen Satellite TV. This is a question for DG Cui. The question is, during the epidemic, for embassies and consulates in the severely affected epidemic countries, are they working as usual, and what kind of help they will render to the Chinese nationals there? Thank you. The CPC Central Committee and State Council are watching very closely and are very concerned about the Chinese nationals stranded abroad. So we have earnestly implemented the various measures. Our overseas embassies and consulates are working as usual to conduct the business. In serving the Chinese nationals for the epidemic containment, we have made some specific efforts. First, we have urged the relevant countries to address the issues or questions related with the health of the Chinese nationals. For people in need of help, they will be provided with assistance. Second, for Chinese nationals who are stranded due to the epidemic, their visa or stay permit should be facilitated. And thirdly, we have taken an active approach to contact the relevant airlines and help the stranded Chinese nationals to change their routes and come back to their motherland. Furthermore, we are working closely with the domestic airlines, and we have already sent 10 flights to bring back home over 1,300 Chinese nationals or travelers. Furthermore, we have worked with the relevant national governments, and for Chinese travelers who were in the Diamond Princess cruise, we have helped them to get back to their hometown. They are mainly the Macau and Hong Kong residents. Furthermore, we are also following closely the treatment received by the Chinese nationals abroad, and we request the relevant governments to provide appropriate treatment and medical services. Furthermore, our hotline 12308 has been kept alive and worked day and night. In the most crucial days of epidemic control, on average, every day, this hotline received more than 1,000 phone calls, providing heartwarming and comprehensive consultation services. Thank you. That's all for today's on-site Q&A, and we will